Hello everyone. Today I am going to explain about chronopharmacology. Chronopharmacology. If we break the word chronopharmacology, we get that chronos is time, pharmacon is drug, and logos is study. So this is basically the study of drug with respect to time. So in chronopharmacology, we enhance the therapeutic efficiency by optimizing the drug effect and minimizing the side effects or adverse effects of drug by using timely medications to the patient. So, the definition of chronopharmacology is that it is the branch of science dealing with the pharmacological action of drug in relation to biological rhythm. It concerns with the effect of drug upon timing of biological events and rhythm. So these three terms, chronophysiology, chronopathophysiology, chronopharmacology, these are interlinked. How they are interlinked? That is that chronophysiology, it is the normal physiology, normal clock or biological clock of our body, and chronopathology, this is the condition when we are in disease, when we are suffering from any disease. So how in that condition how our biological clock works. So this is the chronopathophysiology, and chronopharmacology. It is the study of drug with respect to time. So, for example, our CVS activity or our hormonal activity is not constant throughout the day or throughout the time. It varies according to time. So, on the basis of these variations and by using proper timing, we administer the medication and enhance the therapeutic value of drug by giving them to patients. So this is the chronopharmacology. This is the basic meaning of chronopharmacology. To understand chronopharmacology, we need to understand biological rhythm. So these are the rhythmic biological processes or functions within a defined time period. These are self oscillating during a time between successive repetitions. Uh, there are four types of biological rhythm: circadian, infradian, ultradian, and seasonal. Circadian, it lasts for about 24 hours. Example, sleep-wake cycle. Infradian, it lasts longer than 24 hours. Example, menstrual cycle. Ultradian, it is shorter than a day. Example, neuronal firing time. And seasonal, it is seasonal affective disorder. For example, our body detects changes according to season. And for example, or increased blood pressure in a daytime or decreased blood pressure in a nighttime. This is the representation of biological clock. Here you can see that a specific activity is performed by body at specific time period. So the best coordination of our body is at 2:30 p.m. and the fastest reaction time is at 3:30 p.m. The cardiovascular efficiency and muscle strength is greatest at 5 p.m. The body blood pressure and body temperature is highest at 6:30 p.m. and 7 p.m. respectively. The melatonin secretion starts at 9 p.m. and the bowel movement is mostly suppressed at 10:30 p.m. and 2 a.m. is the time where we are in the deepest sleep. The body temperature is lowest at 4:30 p.m. a.m. and the sharpest rise in blood pressure is at 6:45 a.m. and at 7:30 a.m. the melatonin secretion stops and bowel movement is likely at 8:30 a.m. and 9 a.m. is the time where the testosterone secretion is the highest, and at 10 a.m. we are in our highest alertness. Circadian rhythm. It is the biological clock which regulates functions of our body systems, example hormonal levels, behavior, sleep, body temperature, metabolism, digestion, etc. But why we are studying circadian rhythm here? As there are four types of biological clocks, biological rhythms, then why exactly we are studying circadian rhythm here? So the main reason is that it is 24-hour cycle and it is more helpful in designing various therapies of various diseases. For example, blood pressure, insomnia, digestion, cardiovascular diseases, etc. So the circadian rhythm is regulated by external cues. These external cues are also called as zeitgebers. There are two types of zeitgebers, phototic and non-phototic. Non-phototic include two types, peripheral and cellular oscillators. Cellular oscillators include further two types, organs and cells. Organ include heart, liver, stomach, etc. So, and in non-phototic zeitgebers, there are two conditions, light and dark. So, in light conditions, the light is detected by brain which is detected by retinas present in our eyes, and this input is sent to SCN nucleus, that is suprachiasmatic nucleus present at hypothalamus. This SCN nucleus further generates circadian rhythm, and in that condition, though light is sensed by retinas of our eyes, and therefore SCN do not detect any input through retinas, and therefore it generates motor output to pulmonary gland, which further secretes melatonin, which regulates our biological clock. So now we are going to see the physiology. So the main nucleus responsible for biological clock and circadian rhythm is SCN nucleus. This SCN nucleus also coordinates the activity of other oscillators also, which further generates rhythms. And this is located in the hypothalamus just above the optic child. And the SCN nucleus works by getting afferent input from retinas of eyes, which is stimulated by light, and through the retinohypothalamic tract and also from other tracts. The retinohypothalamic tract it originates from photosensitive retinal ganglionic cells. After getting afferent signals, the STN generates cyclic activity automatically. It generates further efferent outputs. So this efferent impulsion is transferred to the external oscillators which is present in the body. These external oscillators are the target structures of autonomic, endocrine and immune system, which further oscillates and carry out functions of the body. These functions is carried out by adjusting to the rhythmic changes to the environment, that is mostly by day and night rhythm. Uh, this target structures further this generated by secreting the hormones and by secreting other chemicals in the body. The main tracts which are responsible for carry out information is the most important one is retinohypothalamic tract, which is connected to the pineal gland, which is responsible for secreting melatonin. Melatonin secretion is increases in night, and the another tract is SCN connected to periventricular nucleus of hypothalamus. This tract it connects SCN with neurosecretory cells, which secretes corticoluterin HPA, that is hypothalamus pituitary tract, and another cells controlling endocrine gland. So this is the pictorial representation of physiology. You can see that here. Retina present in the eye detects the light, which is input to the sensory organ eye, and this information is sent to the SCN nucleus and paraventricular nucleus, which is present in the hypothalamus in the brain, and this nucleus generates further motor outputs, and which is sent to the pineal gland and to the other different organs in the body present in the body. So this is the physiology of circadian rhythm. So let's talk about SCN, that is suprachiasmatic nucleus, which is present in the hypothalamus, which is called as internal biological clock, and which is responsible for various rhythms like circadian rhythm, annual rhythm, seasonal rhythm, which this SCN nucleus delivers message of time throughout the body by using our autonomic nervous system. It delivers this message by either secreting the hormones from various glands like thyroid gland, adrenal gland, etc., or by secreting endocrine output from pineal gland by synthesizing melatonin. Here, this figure represents the specific time and severity of disease at specific duration of time. So, by analyzing this, chronopharmacology can be applied and the disease can be treated. You can see here that asthma is worse at early in the morning, and CHF, that is congestive heart failure, is worse nocturnally, and migraine is provoked most frequently in the morning. Allergic rhinitis is worse in the morning upon awakening. Rheumatoid arthritis is having worse symptom in the morning, and thromboembolic, thromboembolic and ischemic events like sorry, myocardial infarction, angina, hemorrhagic events of strokes, and are highest during the initial hours of daytime. And Osteoarthritis, it is worse later in the day around evening, and epileptic seizures are more common around the time of sleep at night and early in the morning. So these are the uh, conditions where the disease are severe. So by analyzing this, chronopharmacology can be applied, and the therapeutic activities of drugs can be enhanced. Applications of chronopharmacology. So chronopharmacology is applicable in various diseases nowadays, like asthma, hypertension, oncology, strokes, cardiac heart failure, GIT disorders, peptic ulcers, epileptic seizures, migraine, headache, rheumatoid arthritis, angina, prenatal angina, myocardial infarction, etc. Here I mentioned some examples of chronopharmacology. So let's see one by one. The first is HMG-CoA reductase inhibitor, which is also called as statins, and this is anti-hyperlipidemic drug. So it is usually taken at the bedtime because by taking it in bedtime we enhance the activity of HMG-CoA reductase inhibitor, because these are highly active at night time. So that's why we usually give it in bedtime. The next is asthma therapy. The asthmatic attacks are more common in between 2 a.m. to 6 a.m. and it is observed that the risk of asthmatic attack is almost 10 times higher in patients at 4 a.m. to 5 a.m. in the morning as compared with the afternoon. And also it is observed that this patient is having increased bronchoconstriction at night time, because the effectors responsible for this bronchoconstriction is highly active at night time, like increased parasympathetic tone, decreased adrenaline, decreased cortisol at midnight, increased sensitivity to irritants or allergens at night, or worsening or increased symptoms of allergic rhinitis and asthma. So this decreased adrenaline or cortisol at midnight, it decreases the asthma, but it is present in the low in the morning. Therefore, it is not useful. So we need to administer drugs to for bronchodilation. Also, there are some other factors responsible for asthmatic attacks, and these factors are highly increased in the morning. So these are also responsible for asthmatic attacks, and there is high chances because of these factors. So the chronopharmacology for asthma is to aim to getting maximum beneficial effect from bronchodilation during the during the early morning. Example: sustained release long-acting theophylline. It is taken once in the evening and causes theophylline blood level to reach their peak and improve lung function during difficult early morning. Hypertension. We know that blood pressure is low at 10 p.m. to 5 a.m., that is in the night time. So we do not need to administer drug at this time. But at 6 a.m. our blood pressure is sharply rises and it is in the peak at 6 p.m. So this is the time period where we need to administer drug to decrease the blood pressure or to maintain the blood pressure. So ultimately in the daytime blood pressure is high and it is low at night time due to activated sympathetic system. So there is need to administer drug only in the daytime. So in the chronopharmacology there is concept that controlled onset extended release system, COER. We we can understand this by taking example of verapamil. Verapamil, it is used in hypertension. It is formulated as pill which dissolve slowly, and it is preferred to taken at bedtime, and it exerts its peak effect between 5 a.m. and noon, and no midnight dip in blood pressure is seen. So this is the drug which exerts its effect in the daytime. So uh, due to because of this effect, verapamil is used in hypertension. The next example is fibrinolytic activity. Fibrinolytic activity is responsible for removing the clots from the plasma or from blood. So this activity is reduced in the morning, which is connected with increased risk of tendency in formation of thrombi or clots at that time. So after waking up in the morning, there is high risk of serious events such as acute coronary syndrome or strokes due to formation of clot at before waking up. By using chronopharmacology, we enhance the fibrinolytic activity by giving drugs. The next example is cyclic activity of endothelium with maximum secretion of nitric oxide in the morning and during the day, which is physiological homeostatic mechanism countering the extensive increase in blood pressure as a result of the activity of mechanism. And the another example is at evening and night timing, where functional prevalence of parasympathetic part of ANS, which decrease the secretion of pressure hormone and activity of RAS system, decreasing the blood pressure and heart rate. And the last example is melatonin receptors are used in treatment of insomnia, as melatonin is responsible for sleep. This is all about chronopharmacology. Thank you so much.